I'm really excited to be introducing a topic for this month's campaign, which is incredibly important and relevant in today's workplaces and also within the events industry. And it is intersectionality. Now, what is intersectionality, you may ask? So it's the mix of experiences and identities that we might have as human beings. We are not just one thing. We are not just a woman. We are not just a man. We are not just non-binary. We are a variety of things. We're different ages. We are different races. We have different abilities. And that's what intersectionality is all about. So take my experience, for example. I'm a woman and I'm a woman of color. And my experience as a woman would be different to that of a man, but also my experience as a woman of color is different to the experience of a white woman, for example. And it's all about taking into consideration those things that shape us and our experiences, and understanding that each of our experiences are going to be a little bit different, and the way that we shape policies and ideas and content and processes should be taking that and those intersectionalities into account. So I really hope that you enjoy this month's campaign. Don't forget to follow us on all of our social media channels and stay tuned for the full-length podcast coming soon. And for any of you that haven't met me before, my name is Gabby and I'm founder of Diversity Alliance, the education, training and consultancy organisation for the events, MICE and hospitality industry. My pronouns are she, her, and today I am wearing a navy blue spotted dress with white spots on it. I've got long brown hair, brown skin, red lipstick. My backdrop is beige, but I've got my plant Chaz here with me as usual. Nearly died because I went on a 2-week holiday and didn't tell anybody to water him. So he's been under the shower yesterday. Coming back to life though, looks quite vibrant now, so I'm quite pleased. But enough about me. I'm really excited to introduce our first guest for our Intersectionality Awareness Month campaign. And Dr. Elsa, will you please introduce yourself, please?
Sure. Thank you very much, Gabby, for having me. So my name is Dr. Elsa Zekeng, and my pronouns are she, her. And I'm currently wearing a black silky pussy bow top with black trousers and wearing glasses, sleek backed hair into a bun and nude lips. And my backgrounds are essentially my kitchen / living room. So it's blurred out though. So there you go. So what do I do? So I sit at the intersection of science, entrepreneurship, and policy. Science, as I have a PhD in infectious diseases and global health. Entrepreneurship, as I'm founder of a startup, Soka Data, aimed at increasing diversity in clinical trials. And policy, as over the past easily 10 years now, working with the European Commission, working with various institutions, I've been at the helm of ensuring that policy is equitable, inclusive, usually focusing on health, women, and gender. So that's a little bit of the bio, a little bit of the wrap up of what I do. So I'll let Gabby lead on with some more questions.
Particularly interested in, you actually consulted during the biggest Ebola outbreak in West Africa, is that correct?
Yeah,
Can you tell us a little bit about that and what approach you took to kind of like the different needs that maybe existed in that time and also in that space with the communities, and if intersectionality actually came into play during that time and the work that you were doing?
Absolutely. So it's 2015, taking all the way back, and we start having the Ebola outbreak. So for those who are listening who may not be aware, we probably have about 2 or 3 Ebola outbreaks on average in different countries in West Africa. It's usually DRC. Probably most years always been DRC. But it so happens that it's Democratic Republic of Congo.
Thank you.
Yeah, so it just so happened that in 2015 it spread and it was not contained, because when you trace it back, the outbreak actually started in 2014, so December 2014, and those in charge thought that it was going to be contained a lot sooner, as have happened with the past outbreaks, but this one was a bit different. And this was again because a lot of the traveling and cross-border, a lot of traveling on road and everything else happening with that. So I was doing my PhD at the University of Liverpool. My supervisor, Professor Julian Hiscox, his lab focused on respiratory viruses. And so he did a lot of work with Public Health England.
Right.
And so when the outbreak started, and one of the students in his lab was actually doing her PhD on Ebola virus. So he was directly connected with Public Health England and the WHO, and there was this call that was put out looking for scientists and doctors who would actually deploy to Guinea with the WHO. So by virtue of being in the lab, I guess that's where I was able to get that opportunity. But more importantly, it's something that he always said to me, which is where the intersectionality comes to. He said, also, you're African, but you've lived in Europe, right? And so I have an understanding of the cultural nuance. I have an understanding of how it operates on ground, but I also have an understanding of how science works and how systems operate here in Europe. Right. So I'm sort of literally bridging a gap between understanding how systems work here to be able to deploy out in Africa and be able to spend the next 6 weeks on ground. You can imagine during an Ebola outbreak, Ebola mortality is nothing like COVID. I think it's probably at about almost a 50% mortality rate. So it's very high. And going out to Guinea, we're going to spend 6 weeks working 7 days a week, 12 to 14-hour days, testing samples for Ebola and malaria. So you can imagine when you go to the hospital and you take a flu sample, or you have any sample taken to test for flu or whatever your disease is. We were the ones who would receive that sample, and then we'll have to open it and test it.
Wow, so that's dangerous work.
Literally exposing yourself to actually the virus.
Gosh.
And so the amount of checks and preparation that we had to do for that was a lot. And we had to prepare ourselves emotionally, mentally, and physically, because there's the toll that the work takes on you physically. There's the emotional toll, but also you could not stay out there for more than 8 weeks. I think they had put a cap on it, because the concept is if you stay in the position too long, you start getting weary of your own safety measures, because you think, oh, I've gotten away with it for so long, I can still get away with it. And then that's when mistakes happen, right? So we really had to be on the ball. But I say this to provide context. So when I was on ground, having deployed, I literally was living in intersectionality every single day, right? Because you're talking about cultural nuance, you're talking about individualistic nuance, you're talking about even science having to interact with policy, having to interact with medics, having to interact with all these different bits. And then you're looking at people from all different countries. So I think we had doctors who had come in from Cuba, doctors who were coming from Germany, doctors coming who were local. You had us from the UK. Can you imagine the number of cultures and ways of working that you're thinking about when you're trying to engage with people on a day-to-day basis? And I think that really was the learning there was, when we talk about intersectionality, is there's no one size fits all, right? And when you're talking and you're engaging with people, you have to engage with them on an individualistic level and understanding the nuance that comes with them, which is they may be female, they may be a Black and ethnic minority, they may be disabled, whatever it is, and trying to understand and ask questions that support them and that are accessible and that they understand and that they feel included at every step of the way. Otherwise, you miss people out along the journey. And when you're talking about an outbreak, missing people out is not an option, because that literally could be death.
Yeah.
And so rules and regulations and what sort of policies were created around that, basically, I would say changed every day. And when I say changed every day, I don't mean it was here today, it was there tomorrow. It was little nuances, right? Little bits where you're thinking, okay, tomorrow maybe we're engaging with this set of people. These are the type of things that they're going to think about, and these are the type of data, and this is the type of information that they'll be looking at, or this is what we need to know to be able to engage with them. And then tomorrow it's, okay, maybe it's not that. Maybe we need to have dinner afterwards, because we need to make sure that we bring in that cultural aspect and feel that we, even though it's an outbreak, we can still connect with people. So it's just different things that you had to think about every single day. So I think it really highlighted what intersectionality is for me. And when I came, one of the things that I noticed on ground, which is the experience I was saying that changed me, and it went from something I was passionate about, something I was committed to. I think that happened during that outbreak, was the power struggles between the global north and the global south. And when I say that, it's when we're creating policies and when we're creating partnerships even, right, between different organizations, what could work in the global north will not work in the global south. And how do we make sure that these partnerships are equal? How do we make sure that we're taking on board the best interest of all the different people within this partnership? And so when I came back, I started advocating for that. And then I was selected as a European Commission Young Leader in 2016, and then went to the European Development Days. And again, was on panels with decision makers. I think it was the executive director of the Global Fund at the time, Minister of Health for the Netherlands. And again, just engaging around all these different topics: intersectionality, women, culture, race, and obviously the overarching theme was health. So
that's super interesting. I was trying to relate what you were saying back to the work that I do with organizations within the events industry. And some of that is looking at workplace policies, for example. And, you know, I'm always kind of trying to educate and build awareness around intersectionality and how policies do need to consider intersectional experiences. So we like to give a book recommendation as well at the end of each episode. And it can be around any topic that you want. Sometimes I say, you know, can it be around the topic that we are discussing, with this intersectionality in this case? But actually, I think in your case, I'd say any book recommendation at all, something that you has really impacted you, inspired you, changed the way you thought or felt, or whatever that is. Yeah, tell us.
Well, this is the thing, right? So I have a book recommendation, but the truth is, when I saw the question, the first thing that came to mind, which again is the gut reaction, which I would go for, is I'll challenge it back to saying journaling. So rather than taking something in, think about what you're putting out to highlight your own intersectionality, your own privileges, and therefore how you can amplify that for the greater good, and how you can amplify that for those around you. So that'll be my first challenge, which is for a minute, we all have it. And I got into journaling a couple of years back, and it's been amazing to just sit down and reflect on that. I still do have a book recommendation if you want me to give.
Okay.
Oh, okay.
That's okay. I love the journaling thing, because I've created like a journal template which forms a part of the training with organizations that I do, because we do need to take it inward sometimes. It's great absorbing lots of information, but we need to understand how we really think and feel, and noting that down really helps us to start to understand and play with and maybe question some of our thoughts and motives and feelings. So that's something that I do as part of training and education piece. So love that you brought that up. That wasn't planned at all, but
no, that was not.
Even just as individuals, you're right, it's just a beautiful, worthwhile thing to do. But I interrupted, sorry, carry on. You were going to say something else?
No, I was going to, I think I'll leave it at that. I will not give the book recommendation. I think that will be my takeaway for today. That's just, and even, we need to do within our organizations, as CEOs, as within whatever roles that we're doing, as managers, and even within in the technical space, and obviously more personally as well. So yeah, I'll leave it at that.
I think that's great. Lovely.
And
thank you. Oh, go on.
I was going to say, and obviously you have the prompts and you have the templates, so that's it works. Perfect.
Exactly. Thank you so much for your time. It's been a really seriously interesting conversation. Quite a deep one for we're recording on a Friday morning, but I love it. And there's certainly more learnings that I want to go off and do and get some more understanding based on some of what you've shared today. And I think it's very good to get different insights and experiences from people from different sectors and industries doing different types of work, which I feel that's how we grow and progress in our own industries. We need to lean on and take ideas from other sectors as well. I think, as you said, sometimes we get very siloed, and particularly within the events industry. So this has been really interesting and useful. Thank you so much for your time.
Thank you so much for having me.